Welcome to this very special edition of the KJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through their industry insights, information, or simply learning from them. And today we have Gary Little, author, speaker, inventor, founder of Pain Free. That's me. And he's worked with professional athletes worldwide, helping them break free from chronic pain by understanding the deep connection between stress, emotions, and physical pain. Welcome to the show, Gary.
Welcome. It's great to be here, KJ.
You are welcome.
Really
Welcome to the show, Gary. Welcome to India in this online form. And I'm sure not just in India, but a lot of people across the globe will benefit from what we are going to talk right now. We'll learn from you how one can dissolve pain in minutes without therapy or medicines, as you so we'll learn all about this. We'll also learn about your patent pending method that eliminates pain instantly without stretches, exercises, or ongoing treatment. We'll learn all about that. But before that, Gary, let's learn a bit about you, your background, your journey, so that people know who they are listening to.
Thanks, KJ. I am from Australia, and probably the accent. One of the things that I started my career in a very early stage of my life, and when I was in my 20s, and got into the industry, and I really struggled with how we're treating pain and injury. And it's been a 35-year journey, and as you mentioned, have been privileged to work with some world elite athletes around the world. That gave me a lot of confidence in about what's happening within the industry. We have a pandemic in physical pain, and there's so many therapies, so many information out there, every social media. But one of the things that I realized that what is causing pain, and that's been my journey, and that's one of the reasons why I put the program together.
Absolutely, absolutely, Gary. So just to understand it better, means I don't know if you are a doctor or not. If you are, do let us know. If you are not, do let us know. But then you seem to know about pain much, much better, perhaps, than the pain management, experts and doctors and so many of these people. Why is it that leading athletes came to you? Why is it they did not go to a normal person, as a doctor or somewhere else? I want to understand that that whole thing about pain, pain management and so many other things.
Great question. And one thing that KJ is that pain management, I don't want to manage it. And this is one of the whole idea of the whole industry of pain management therapy, the therapy go around. I am a therapist, physical therapist. I've been a holistic counselor, and I've done a Pilates instructor, and I've done a lot in the industry. But one of the things that what drove me is, and the reason why I can challenge anyone in this industry, professors, and I work alongside professors and top trainers and coaches and orthopedic surgeons, we need to know why we have pain. And unfortunately, the industry is not teaching people how to they're teaching people how to get rid of the symptom. But what is causing pain? That's what I've done and brought that together. And one thing that, to answer your question, the industry is designed to train practitioners to treat symptoms, and we've got such a vast, different therapists, and yet pain and injury is going through the roof. And the thing is, that's been my journey, 35 years to hunt that down. And one thing that understanding the physical body and understanding the emotional body is one. It's not parts.
Absolutely. So what should we understand about pain, Gary? How would you like people to understand about pain? Because your mission, you say, is to make pain optional. Who wants pain, Gary? Tell us a bit about that.
Pain? So one of the things that I, through my journey and what I've done with athletes and different people around the world, I just take, and when I'm working with people, I take the physical stress pattern out of the body. And one of the things that the biggest cause of physical pain, whether you've got a disc problem, migraines, hip problem, knee problem, whatever it is, if you haven't had a blow to the body or hit by a truck, injuries that just come about for no reason. There has to be something wrong. And one of the things that this is one of the reasons, just to answer your question around therapists and doctors, you cannot see stress in the muscle tissue on X-rays or scans, and that's the biggest thing. And I did a mention the other day to a group of people to really turn this industry around. If we can test and show people how much stress is in the muscle tissue, we can turn around the whole industry, because that is the biggest cause of physical pain. And emotional stress is held in the subconscious mind, and that controls and contracts the muscle and crushes the body. And that's when we have all kinds of different name tags. So every name tag is the root cause of unhealthy muscle tissue.
These are technical terms, Gary. As an individual, you are right. A lot of people understand these things. But from a very, very simple person on the street, they don't know anything. They just know whether anything is painful or not. From a toothache to a heartache to an ankle ache to whatever it is. They just feel it.
Yeah.
And when they feel it, they want to not take medicines. But sometimes you have to. Toothache can be very difficult. Any ache can be very difficult. Any pain can be very difficult. You go and try and get some medicine for that. How should one look at that? You talked about stress. You talked about muscles. They don't understand these things, Gary. A person just understands pain. How should you, how should you you haven't hurt yourself, but you wake up and you feel pain. You want to take care of yourself. How do you look? How do I get started with looking at pain from that point of view?
One thing that just to for the listeners is to understand the muscles are just pulleys and the bones are just levers. That's all our body is made up of, just pulleys and levers. So if we look at muscles as just as a pulley, and if it's stressed, it's shorter than what it has designed. So when the muscle is short, and then the muscle is loaded and placed under load, it crushes the joint, for example, and then it has impacts on the disc or the joint and the nervous system and the muscle tissue. It's just stressed. But once you get the stress out of the tissue, and the muscle will stay at the same length, at the right length that is designed, the pain will drop away. And whether people have got a disc problem, whether people have had a lot of clients that have booked in to see surgery, major disc problems, and in a week they've been able to become pain-free, purely because to get rid of the stress, instead of the muscle being a certain length, it's shorter in a relaxed state. That's stress. And yet when we can get the stress out of the tissue, and this is where exercises can come in to activate a muscle, and the only reason that exercises decrease pain, you're bringing blood into a stressed muscle, and the muscle will lengthen for a short period of time. That's how you decrease pain, but it doesn't fix the problem. The biggest problem that just people to take away is stress in the muscle tissue. When we get anxious, we get angry or argument or whatever, we contract. And when we keep feeding that emotion, the muscle contracts and crushes the body. And so the whole idea is to go to the real source of the stress, is emotional stress. When we get anxious, relationship, anxiety, shame, guilt, all this carries in and unknowingly crushes our body and causes our pain. Does that explain a bit more about that?
Yes, yes. So in simple terms, if there is a pain from anywhere, then we should look at mainly from one of the things we can look at is from the emotional angle. If there is something which is actually the root cause, emotional something that is the root cause of this particular pain. Am I understanding it correctly,
Yeah.
Gary?
You certainly are. You certainly are. And there is a lot of great therapists out, like Dr. Sarno, Dr. John Sarno. He's leading this world. He's not with us anymore, but he's leading the what, and people can look up that. But one of the things when I read and spoke to Dr. Sarno, it's all emotions. But the thing is, people have got X-rays and scans, and because it's a physical pain, we think it's a physical problem. And one of the things I don't know if there's any other program out there that teaches physical. We need to drop the physical stress out, and that's where the patented tools that I've developed, where people around the world can drop the physical stress out of the muscle tissue. Then we go on and put them into a 30-day program to drop the source of the stress, and that's our emotional area of our body. And our emotional part is where the origin of pain comes from. So, but we need to understand both for us to really engage and embrace this kind of understanding. And just the industry has taken that away, and they treat symptoms, and that makes them a lot of money. And I left the industry because I didn't want to do that.
Okay, okay. So generally what happens is, for a quick fix thing, we just go to the modern methods of medicine or some sort of ointment or anything that is available, and that takes us only to looking at the symptoms rather than looking at the problem from the root cause of the problem. Do the medical industry have an option? They are known to provide a quick solution. What can we just say? It's all about money, or is it because that's what also patients want? Nobody wants pain. Who wants pain, Gary?
Do you know practitioners? And part of my training is to get people back, and the people that are listening and watching this. My training is, in every single practitioner is trained to get you to come back. And to me, that is so wrong. And that's what's causing the industry. And the real problem comes back to the education bodies that teaching these modalities and the healthcare industry. The only way we can do this is to empower people and break it without therapy, because I am a therapist, and I left the industry because I was part of the system. I'm treating symptoms. So if emotions and how we feel emotionally sets up the contraction and the stress in our muscle tissue, I can only treat symptoms, even though I've had amazing results with clients. But the thing is, I'm only working on the symptoms. But when you empower people to take a full understanding of, they can drop pain. I was speaking to a client in the US this morning. In 2 days, she dropped her shoulder pain within 2 days, and she slept. And once you know, and we don't even know, we're given stretches and exercise. I used to teach this stuff. But the question that we need to ask some questions to our therapist. Why is my muscle tight if we're giving stretches? My question is, why is the muscle weak? When we ask those most basic questions, I can guarantee the practitioner will not be able to tell you. That's the problem. And the real issue is the stress in the muscle tissue caused by our emotional body. And once we increase, and even from a psychological point of view, there's a lot of people out there saying all these techniques about NLP and so on and so on. But the thing is, it's much simpler than that. When we understand our physical body, We go to the gym to put our body under load, and that's healthy. But the thing is, we are programmed to, when we put our emotional body under load, we run away, we take drugs. We need to get bigger and grow from the stress, and that will build resilience. And I believe the epidemic we have in mental health is, and no one can argue with this, the biggest cause of mental illness is lack of resilience. And so that's what I really excited to share with people, to get them out of this cycle. And I really feel people like that's got back pain, like we never ever think, what is causing the disc problem? Everyone on social media is saying a disc problem, it's a nerve problem, it's a spine. Why is my spine like that? Why is my nerve like that? Why is my disc like that? They can't even tell you. This is the reason why we're stuck in pain.
Absolutely, Gary. So as an individual, what are the things that I should do every day? What is it? Prevention is better than cure. What are the things that I can do? Make my body resilient. My emotionally, I become much more resilient. Overall, I become much more resilient, and I don't feel, or I feel less pain. Tell us also about your, patent pending method, so that, in that backdrop, we'll understand it better.
Okay, so one of the things that we need to understand what's happening in our body, and that's one of the things my program gets you to find the stress pattern. Like, for example, if you got lower back pain, it's not the muscles in the back. It's generally the muscles in the quads, in the front of the thighs, and I activate and put them under stress and bring blood in there. If that drops pain within minutes, that is the stress muscle that we work on with the patented tools. I replace myself as a practitioner when I'm working on people with the patented pending tools, where you can drop that stress out of your own body. It doesn't matter where you are in the world. And that is a game changer within the industry. Every single product, all the rollers and all the gadgets and all the massage guns, they never ever tell you where to work, why you're working this, and you just buy it and hopefully you get rid of your pain. Then we drop the pain, and a lot of people, and especially with lower back pain, I believe I'd say 80% of people within 5 minutes, they drop it probably up to half their pain, because it's the real issue. Then we take them on to, and that's the tools, and they're simple to use. It's all video and education and books, and the whole program on teaching you how to work that, and a 6-hour training program to drop and change our mind and our lies that we've been told in the industry. We don't even know how to ask basic questions, and we just go on, and because a practitioner tells us to do it, but it doesn't make sense. So then we, when we understand the physical side, is that we put them into a 30-day program to get to the real cause, and not only bring up the emotion, but empower ourselves from the emotion. So what someone can do, generally from an emotional point of view, is just start writing. Just start writing and vomit and getting all that out, and just become aware of what is happening. Just having awareness. I've seen so many people just drop their pain, just because the physical and emotional connection. We're lacking common sense. I teach common sense. So that's and becoming aware, getting into a meditation, quietening our mind, and then getting into dissolving the stress out of the body. And just to finish off here, KJ, is, and I know there's people out there think they've tried everything, but I can guarantee you that everything that you've tried does not make sense. I guarantee it. But what I teach is common sense, building awareness. The more awareness you become around our own body, pain drops away. because we're working physically. Instead of going to a practitioner and they're trained to treat symptoms, I teach you to take control of your body physically and emotionally. You've only got to learn about one, and it's pretty simple once you become aware.
Absolutely, absolutely, Gary. But what about pain, which is, clinical? You have an illness, you have a disease, some sort of advanced illness that also brings a lot of pain, cancer, so many different sort of things. How should one look at those sort of pain? For that you will need a lot of aggressive medication and all that stuff, and that is bad. How should one look at that sort of pain?
Great point here, KJ. And the thing is, I am only talking about physical pain, musculoskeletal pain, disc problems, neck pain, and elbow pain, and knee pain. But one of the things that we need to be aware, we need to be really understanding. If someone's got serious, I had a client today, believe it or not, she's in a wheelchair. She had cancer of the spine. And so when people have serious illness, and it's not hard to go to the doctor and get tested, once you're clear, it's okay to really go on and put these principles in place. But the question is would emotional and would stress impact every single disease? Absolutely. So one of the things that we need, stress is our biggest killer in our society. No one's dealing with it. We just know that stress is causing it. But how do we break away from that? But the thing is, if we look at stress as our greatest gift, instead of looking at it as our worst enemy, when you go into a gym, you pick up weight. That's resistance for the body. When we go into our emotional gym, those stresses in our lives are there purely for you to grow. And we need to become greater than the challenge. And everyone can do that with awareness. Doesn't matter if it's finance, doesn't matter if it's a relationship, doesn't matter if you lost one. There's someone that's pushed through and they've come out the other end and be a better person. And they think the biggest challenges in their lives because it's made them greater than what they were before they had to challenge. And that's, I hope that explains something there.
Absolutely, Gary. Absolutely. There's much to learn and understand about pain from you, Gary. So, who is the ideal person for you in terms of pain? Who are the people, who are the best clients for you, who should connect with you, who will be surely getting respite from you? Who are those people, and how do you deal? What is it that you offer to them?
Okay, so one of the things that if people that want to do something and outside the industry and outside of what we've been, because it's obviously not working. If someone wants to take responsibility of their physical and emotional body, they can have a massive change within their physical pain, massive, and break away from the therapy go round. I've been in the industry over 35 years. It is not working. Just here in Australia is $144 billion. And there's more therapists going around and more therapists. And I had a client come to me the other day and she asked, could I bring my partner? Her partner was a physio, was trained 2 years. And he didn't even know. He came in and he was so honest. He said, I know nothing. I'm not confident. This is a trained physio. I am not confident to work on my girlfriend's neck. So he had to pay me. I was teaching a physio. We are lacking common sense. So I just had to throw that in there. So understand the industry, ask questions, and they are not God. Just because they got a piece of paper, but they've got no common sense. So the right people, someone that wants to stand up and take responsibility, And if someone wants to reach out to me, my TikTok is a lot of information. I put TikToks up there. People don't like TikTok. Go there and just listen to the videos. And go to my link tree and book a free half-an-hour consultation. I am passionate to reach people, and even if you don't do the program, I'm happy to speak to anyone to give them hope to make them a bit more aware so they can take responsibility. And also you can contact me on my website, painfreethat'sme.com as well.
Absolutely. With this, it's a wrap on this very special edition of the KAJ Masterclass Live. Thank you so much indeed for joining us.
Bye-bye.